With all the marketing, the buzz online, and all of the publicity that Medicare Advantage plans receive, you'd be surprised to know that there are a lot of people that enroll in a Medicare Advantage plan and then they want to disenroll once they figure out how the plans actually work. Hi, my name is Mark Pripp. I've been helping people compare and find the right Medicare plans for over 15 years. Today, I want to take a moment and shed some light on some of the downsides of Medicare Advantage plans and why a certain percentage of the population is choosing to leave or disenroll from them. Annually, roughly 17% of Medicare beneficiaries disenroll from a Medicare Advantage plan. This number continues to increase as more and more people switch to a Medicare supplement plan. There are three big reasons that Advantage plan members leave their plans: network restrictions, high cost sharing rates, and annual plan changes. To summarize this whole video, I could say one thing. This is what I have seen in the last 15 years with Medicare Advantage plans. The big print giveth, and the fine print taketh away. Most people don't realize how Medicare Advantage plans actually work until they enroll in a plan, and 6 or 12 months later, they now have experienced how that plan is going to work for them. The first big reason, and this is one that I see a lot in our office with people calling in, are network restrictions. Those are usually caused by beneficiaries enrolling in an HMO plan, the most common Medicare Advantage plan offered. These plans can cause problems for those enrolled because they limit the doctors and providers that beneficiaries can see, especially if an approved doctor that you're currently using and seeing leaves the Medicare Advantage network. These plans also don't provide coverage outside the local region, which makes them inconvenient for travelers. All Medicare Advantage plans are going to cover you nationwide for urgent matters or emergency care. The limitations you receive in an HMO in your region or nationally are for things that are not emergency related or urgent care. So those planned treatments or planned procedures. Additionally, Medicare Advantage plans require low cost sharing rates on most procedures, but often ask members to pay a larger share on the most expensive covered services. This makes the cost of an Advantage plan higher than many beneficiaries originally bargained for. Most people are looking at and are told by agents that are not doing a good job how the benefits work. They usually said, oh yes, you can go to your primary care for a $0 copay. You can see a specialist for $25. But they usually don't get into the more complex things like paying $300 to $400 a day if you're hospitalized, or an outpatient surgery, or even chemotherapy. In some plans, you may be responsible for paying 20% of that treatment, which gets very, very costly. So that would be an area that I would refer to as the fine print taketh away, and you don't realize that until you're on the plan and have used it. Unlike Medigap, which is also known as a Medicare supplement, Advantage plans can change their benefits, copays, or deductibles annually, leaving beneficiaries stuck with inadequate coverage or forcing them back to the marketplace to find a better plan. The Medicare Advantage companies are allowed to change benefits and premiums during that once per year annual election period. So when you first enroll in your plan, it may be appealing and attractive, but as you're on it longer and longer, those copays can increase and your provider list of doctors and hospitals can change. And when I say change, I typically mean it's very common for a hospital group or medical group to get into a payment dispute with your insurance company. So you have a large hospital that says, we have 30,000 patients that have, say, United Healthcare or Aetna or Cigna, and we are not going to renew that contract because we couldn't agree on the terms of the agreement. So the contract ends, which requires you to find new doctors or a new hospital hospital if you want to keep that plan, or pushes you back to the marketplace to say, hey, I'm on a plan, I just lost my doctors and hospitals, I need to keep those providers. Can you find me a plan that allows me to do that? That's very possible, but it creates a lot of work for you. Now that the dispute has taken place and wasn't resolved, it's pushing you back out to now find another plan that is suitable. Now, I touched on Medigap plans briefly, but let's go a little bit deeper. While Medigap plans may require a higher premium per month, they often come with more comprehensive benefits, making them a better choice than Medicare Advantage plans. Here are some of the biggest benefits that Medigap plans offer. This one is key right here. Number one, since the government has established Medigap benefit structures, insurers cannot change them on a whim or even change them annually. Typically, the Medigap or Medicare supplement benefits remain the same year over year over year. Things that may change is if you're on Medicare Supplement Plan G, you're responsible for the Medicare Part B deductible, which is only a few $100s, but that amount can go up in time. If you have Medicare Supplement Plan N, which requires copays for certain office visits and emergency room, those copays have the potential to change over time, but it's a very small percentage of the overall Medicare supplement benefit. With Medicare Advantage, all benefits, all features, all cost sharing, all networks are always on the table to change on an annual basis. So Advantage plans have many more moving parts than Medicare supplement plans. Medicare supplements have no network restrictions. You can see nearly any doctor or specialist that accepts original Medicare. No referrals, no provider disputes with the hospital or the medical group with the insurance company. Those disagreements and arguments just simply do not exist because there are no contractual agreements between a Medicare supplement company and different providers and hospitals. As long as you're seeing a provider or hospital that accepts original Medicare, that automatically means that the Medigap or Medicare supplement is going to pay the remaining 20% and has nothing to do with network. A few of the other features on Medigap plans that I love. Let's take a look. Medigap plans do not have any copays. Once you pay your premium, office visits, testing, surgery, and hospitalization are covered at roughly 80% by Medicare, and the Medigap plan pays the remaining 20%. So with original Medicare as the primary payer, roughly 80% without going into all of the fine, minute details of the original Medicare copays. The simplest way to say is Medicare covers 80%, the Medigap pays the 20% balance. The most popular plan is Plan G. That would require you to pay your Medicare Part B deductible. Then the 20% takes place. If you're on Medicare Supplement Plan N, you would also have that Medicare Part B deductible, plus the small co-payments on office visits and emergency rooms. Now, one of the drawbacks with a Medicare supplement or Medigap plan is they do not include the prescription drug coverage automatically like you see with most Medicare Advantage plans. So if you opt to disenroll from a Medicare Advantage plan and go to a Medicare supplement, then you would also need to consider picking up a standalone prescription drug plan that would help you pay for your medications. Each year during the annual election period, you have the option to disenroll from your Medicare Advantage plan and enroll in a Medigap or Medicare supplement plan. If you have been on Medicare longer than 12 months, if you try to make that switch, that Medigap company will have health questions and underwriting that you would need to qualify for in order for the Medicare supplement company to approve your application. Typically, the best time to enroll in a Medicare supplement plan is during your Medigap open enrollment period. This period starts the first day of the month that you turn 65 and are enrolled in Medicare Part B, and then it lasts for roughly 6 months. This is the best time to enroll because you have guaranteed issue rights, which means you cannot be denied even if you have health conditions. Now, other times may be is if you move, that would create a special election period. Let's say you're on a plan, an HMO in one county, you move to another, that HMO is not there. That creates a special enrollment period where you can then opt for a Medigap plan. There are some other smaller areas that a special election period may work. If you have questions on those, comment below or give us a call because those varies by individual circumstances and situations. I have helped thousands of people understand Original Medicare, Medicare Advantage, and Medicare supplements. Unfortunately, the Medicare Advantage market and advertising is much bigger than the Medicare supplement advertising and awareness. When it comes to Medicare Advantage, the big print giveth, the fine print taketh away. Understand what you're getting. Ask questions. Ask about copays. Ask about referrals. Ask about networks. So here's my final thoughts. The problem with Medicare Advantage, again, is all of your advertising, all of the marketing in your mailbox, all of that carries a heavy emphasis on free grocery benefits, a free gym membership, and maybe a zero premium. They're not going to get into prior authorizations, referrals, network limitations, higher copays for hospitalization or chemotherapy care. They're simply not going to promote those as value adds. They're going to promote the things that look the most appealing. So if you find yourself in a situation where you want to get off of a Medicare Advantage plan, you really have two choices. Wait till the annual election period, or if you're brand new to Medicare, you may have a window where you can switch as well, or if you've moved or made lifestyle changes, you would have a special election period. In my professional opinion, Medicare Advantage plans are helpful to people, but Medigap or Medicare Supplement is far superior. There's a ton of flexibility and freedom that allows you to do what's best for you and your healthcare needs on a Medicare Supplement plan. If you have questions, comment below, give us a call if you want to do a needs analysis to decide, can you disenroll or do you need to wait? Or if you'd simply like just a simple comparison of the two plans that are available, we'd be happy to help. Thanks for watching.